Hey everyone, Ryan here, and welcome to our bonus practice questions video for the patient management series. Now in this video, we're going to test everything that you've learned in the last 10 videos. And we've covered a lot of things in this series. If you haven't already, I would definitely recommend watching those videos first. I broke down the material covered on the board exam into 10 videos of high yield information. And as you'll see, this information will really help you on the board exam. So I compiled 15 questions for us to go through from old release questions, practice books, and questions that I modeled after actual exam questions when I took the exam. So these are going to be very similar to what you see on test day. So with that, let's get started. So question number 1, which of the following American Dental Association principles of ethics states that a dentist has a duty to respect the patient's right to self-determination and confidentiality? So go ahead and pause the video, think through the question, and then we'll go over it together. So if you've watched any of my practice question videos, you know that my number one strategy is to break down the question and start with what you know. Now, if we didn't do that and we just jumped right ahead to the answers, well, privacy sounds pretty good because, well, that's what confidentiality is all about, right? But C is a classic trap answer because privacy is not a principle of ethics. And that's essential to answering this question. Privacy is actually part of HIPAA. So I would go through first and rule out any answers that are not ADA principles of ethics. Now, non-maleficence means do no harm, justice is fairness, veracity is truthfulness, and patient autonomy, the last one here that we're going to talk about, is self-determination and confidentiality. Now, all four of these are principles of ethics, so of the four remaining, certainly makes sense that patient autonomy, their rights to their own patient information, and they're making their own informed decisions, that certainly fits the bill with self-determination and confidentiality. So if we go through the answer with a routine sense of breaking down the question, finding the key concepts that the test makers are trying to test, and then looking for the answers logically, we get to the correct answer being patient autonomy. All right, question number 2. During an informal session of motivational interviewing, your patient says, "I don't have time to quit smoking." What stage of behavior change is he or she in? So go ahead and pause the video and then we'll go over this together. So the test maker was very thoughtful in this case and ordered the answer choices in the correct order for you. Now, this doesn't always happen this way, but it's great when it does. So we'll take advantage of this. Pre-contemplation is when you're not even considering behavior change. Contemplation is when you're starting to consider it. Preparation is when you're preparing to take steps to change. Action is when you're engaged in physical action towards that behavior change. And maintenance is maintaining that changed behavior. And this is the classic. We looked at this cycle that happens when someone is going through some type of pivotal change in behavior in their lives. Now, the behavior change in this example is to quit smoking. Now, the patient says, "I don't have time for that." Well, they're actively opposed to it. And so they're not even considering quitting smoking at this time in their lives. So this would put them at the pre-contemplation stage. So the answer here is A. Now, as a side note, when you're studying with these practice questions, one really valuable study strategy is what I call flipping a practice question inside out. So if the answer is A, which in this case it is, how would I change the question prompt, this part here, in order to make the answer B? What would I have to change in the wording here to make B the correct answer? How would I make the correct answer be C? etc. And you can go through each answer choice that way. And that can help you get even more mileage out of any practice question you come across. So give it a shot and let me know what you think of flipping the questions inside out as part of your studying. And here's that circle I was talking about with the stages of change in behavior. All right, question number 3. The blank section of a scientific article provides the reader with detailed information regarding the study design. Go ahead, pause the video, and then we'll talk about this. All right, so these are all 5 distinct sections of a paper. Abstract, of course, appears at the beginning of the paper. It's the SparkNotes version that everybody tends to read. It provides a quick summary with not any detailed information, so I could pretty confidently rule out abstract. It's not going to be providing that sort of detail we're looking for in the question. Now, background and introduction, I said distinct before, but they're actually synonymous. They're basically providing a background on the topic, why it's important and relevant. It's talking about aims of the study, the hypothesis or hypotheses. Again, we're not getting detailed information regarding the specifics of the design of the paper, so these are also incorrect. Now, the discussion section is interpreting and making sense of results and findings. Again, not really regarding the study design per se, so that one, I'm not too fond of that answer choice either. Where the methods, routinely called materials and methods or just methods, provide specific information about the population being tested, the independent and dependent variables, sampling method, experimental design, statistical analysis, all of those numbers. And like I said in our evidence-based dentistry video, it's arguably one of the most important and honestly underestimated sections of a scientific paper. So if we're looking for detailed information regarding the study design, this is certainly the place to look. So the answer here is D. All right, question number 4. Which of the following is an effective community prevention program? Go ahead and pause the video and then we'll go over this together. All right, so the tricky part of this question is that all of these answers are good prevention protocols, but the key word here is community. Only one of these is a community level prevention program. The others are all at the individual level. So you can think of the individual level as something a dentist would tell an individual patient during their checkup visit. So they would tell them, well, you should brush twice a day, you should floss every night, keep seeing us for regular checkups, and maintain a low sugar diet. But school sealant program, that's a little bit different, and it's a very effective community level program because it covers multiple people at once. Once it's in place, you're covering multiple children at school that can receive these sealants. Now, it's not quite as effective as community water fluoridation, which we said before is our most cost-effective community prevention protocol, but school sealant program is certainly another example of that. So our answer here is D. Question number 5. Which method of sterilization is least likely to dull and corrode carbide instruments? Go ahead, pause the video, and then we'll talk about this. All right, so this is a nice little infection control question here. Corrosion is a natural chemical process where the metal deteriorates, it forms an oxide, and it's usually caused by contact with an acid, but it could be something like water or some other liquid. Now, in the case of steam heat, we're essentially putting these instruments through a pressurized sauna. Ethylene oxide is also very humid. It's not as hot, but it does have a high moisture content. And glutaraldehyde, well, we're essentially bathing instruments in this liquid. Now, dry heat is the only one here that has very low moisture, as the name suggests, and has the best preservation of cutting edges as a result. So if we didn't know specifically this high yield fact, we could try to group things together, see if we can get 3 of them on the same page, in this case 3 methods that involve high humidity or moisture, and find the one that doesn't belong. And in this case, dry heat is the best example of that. So the best preservation of cutting instruments and the least likely to dull and corrode is the dry heat method of sterilization. All right, question number 6. What is an example of a conditioned stimulus for a dental patient that had a previous bad experience at the dentist? So go ahead, pause the video, and then we'll go over this together. All right, so this is a good question looking at the concept of classical conditioning. So the example I use in dentistry is the dentist gives you an injection, which is an unconditioned stimulus, but it's painful and causes anxiety, which is an unconditioned natural stimulus for somebody. Now there's also a neutral stimulus present, which is the presence of the dentist who gives the injection. And that dentist is usually wearing a white coat to give said injection. So once this is repeated multiple times, that patient is getting multiple injections from a dentist with a white coat, the mere presence of the dentist will eventually cause anxiety for the patient by itself, because now we're linking that previously neutral stimulus, and now the dentist is becoming the conditioned stimulus. But if we're being honest, there are multiple conditioned stimuli that are appearing in this example. Not only the dentist administering the injection and the white coat they're wearing, but also just going to the dental office, waiting in the waiting room, getting called back, and sitting in the dental chair. These are all things that are happening every time you're experiencing the injection or the drilling, whatever really bothers you. And so all of these things become conditioned stimuli. Now, with that in mind, well, there's really only one answer that makes sense here for a conditioned stimulus. High blood pressure, intrinsic fear, anxiety of a parent, these are all things that are more internalized fears. They're not linked to what's actually going on behind the scenes. But the dental chair was, like in our example, is something that's in the background of your experience. It's in the circumstance, and you're subconsciously linking that to this feeling of pain and subsequent anxiety from the dental injection or whatever it might be. And so in this example, dental chair makes the most sense for an example for a conditioned stimulus. And here's our example of Pavlov's dogs that we went over in detail in our behavior change video. All right, question number 7. Which of the following is not included in the ADA Code of Conduct? Go ahead, pause the video, and then we'll go over this together. All right, so this one is actually a bit tricky, but I see this concept come up all the time, so I definitely wanted to include it in our practice set. So remember, the principle of ethics is our list of 5 principles, and the code of conduct is the demonstration of those 5 principles in day-to-day dental practice. So let's go through these one by one. Licensure by credentials. So this is essentially the requirements for getting a dental license. Vary state to state. Not really sure about this one. Let's come back to it. Advertising, fees, and patient care. Now the dentists must not falsely represent care being rendered, fees being charged, or advertising of their dental practice. These are scenarios where the dentist is ethically required to be truthful for the patient and the community at large. So these are all examples of the ethical principle of veracity or truthfulness. So those are certainly included in the code of conduct, and they actually are. If you went on the ADA website, you looked at the code of conduct, there are specific subsections for each of these. Now, what does slander mean? That means you're saying something bad about another dentist or another dental professional. This is also something we should not be doing under the code of conduct. This is an ethical requirement not to slander another dental professional. And this is under the ethical principle of justice or fairness. So that is also included. Now, licensure by credentials, as I alluded to before, it varies from state to state. It's not really an ethical concern. There are certain requirements that you need to uphold and meet, but they're not under the 5 ethical principles. So the answer here is A. All right, question number 8. Which technique is typically not useful in treating an anxious patient? All right, so go ahead, pause the video, and then we'll go over this together. All right, so let's go through the answer choices because these are a little bit longer. A is using less structure in establishing rapport. B, reassuring the patient by telling the patient not to worry. C, providing reasons before asking for sensitive information, using empathy, or making expectations clear. This is a little bit tricky if you're just looking at it and kind of thinking, well, they all sound pretty good, right? Like all of these would potentially help an anxious patient out. Using less structure in establishing rapport. So that's kind of talking about, well, we really want to just be open with the patient, try to get to know them, right? Rapport is all about establishing that initial level of trust. And an anxious patient, trust is incredibly important. Potentially, someone who's an anxious patient, like we talked about in one of our previous practice questions, they could have had a bad experience. They could have had a previous dentist where things really didn't go well. And so they might have a lot of questions, a lot of reservations, a wall built up between you and the patient. So rapport and taking time to get to know them can be a really useful trick. So I think that's a great thing to do. C, providing reasons before asking for sensitive information. This is another thing that's providing trust, right? You're giving somebody, you're not just asking personal information from the patient right off the bat. You're letting them know, well, hey, we really need to know this for comprehensiveness of care, and we really appreciate any input you might have. Using empathy is one of those answers that you can never really say that's not a good thing. Empathy is always a great thing to use. And making expectations clear is another one of those kind of, yeah, that sounds good. That's something I can't really argue against that. I can't really say that's not a useful thing to treat an anxious patient. So the only thing that really sticks out to me is reassuring the patient by telling them not to worry. And don't worry is a classic trap response. That's a really easy thing for a dentist to say. Oh, don't worry, it'll be fine. You'll be just fine. And providing this premature reassurance can actually compromise trust and rapport with the patient if it's not consistent with what actually happens, right? If they're actually in a lot of pain and it wasn't easy and they didn't feel fine, then they're not going to trust you next time you say something like that. So it's better to be upfront with them, establish rapport, make them know that you're in it for you're in it for them, right? You're not trying to be standoffish. You're actually trying to help them. You're not trying to hurt them. And so if they know you're on their side, but they also know that the appointment's not necessarily going to be enjoyable, then they're more likely to be on your team. So the best answer here is to not provide premature reassurance and be honest and upfront with them, provide empathy, and give them someone to trust. So the answer here is B. All right, question number 9. The variance for dataset A is 21, and for dataset B is 7. From this, we can conclude which of the following. Go ahead and pause the video, and then we'll go over this together. All right, so this is a nice little statistical question here, and if you know what variance is, this answer is actually pretty straightforward. So variance is one of those measures of dispersion, how spread out certain numbers are in a given data set. And the larger that number is, that means the more spread out the numbers in that data set are. So if we know that, we can narrow down to the correct answer. So we know A has a higher variance than C, so which of the following is true? There are more items in dataset than dataset B. No, we don't know that specifically. That's not what variance is talking about. The mean of dataset is smaller than the mean. No, this is a measure of central tendency. That doesn't have to do with variance here. And I think what they're trying to say here is that, if the variance is 7 here for B, and it's 21 for A, then maybe this is supposed to say the mean of dataset B is smaller than the mean of dataset A. But regardless, that answer choice is incorrect either way. And C, the items in dataset A are more widely spread about the mean value than the items in dataset B. Now that sounds pretty good because we know that if the number variance is higher, then the values are more spread out. And the standard deviation for dataset B is larger than the standard deviation for dataset A. That's actually incorrect. A should have the larger standard deviation because that's another measure of central tendency. So the answer is C. All right, question number 10. Which of the following is an arrangement between a plan and a group of dentists whereby the providers agree to accept certain payments, usually less than their usual fees, in anticipation of a higher volume of patients? Go ahead, pause the video, and then we'll go over this together. All right, so let's start with B first. Capitation is a per capita payment plan. So that's not really relevant for this question. It's asking about an arrangement and more sort of the organization of the dentist, the structure of the dental care. So capitation is a payment plan that's not relevant. Medicare is a government health program, and although fees are lower, you're not necessarily getting a higher volume of patients, so that doesn't really fit with the wording in this question. And an HMO is not an agreement between a plan and a group of dentists, so that's not really correct either. And so we only have one good answer here. The only correct answer is PPO, which from the red text in our insurance video is a panel of providers that agree to accept less than usual fees in exchange for a higher volume of patients. And that's because the subscribers to this plan have a financial incentive to use providers from this panel. And that's why the providers agree to accept lower fees. So the wording is really important to nail down for what a PPO is. It's a very specific arrangement, and it certainly will come up on the board exam is exactly as I have worded here. So the answer is A. All right, next one. Which of the following is a component of the ORS model? Go ahead, pause the video, and then we'll go over this together. All right, so I think I mentioned when we talked about this in the health behavior change that I got a question pretty much like this on the board exam. It kind of threw me a little bit because I didn't memorize specifically what each of these things means. So I'm hoping that you don't make the same mistake I did, because this is a really simple question to get if you've memorized what ORS stands for. But if not, Well, let's see if we can narrow down the choices. Well, the OARS model refers to motivational interviewing, which is a form of counseling for patients to help them go from a mindset of indifference to a mindset of change. So you help them arrive at a new mindset on their own. So let's go through the answers and see if we can narrow down what this could potentially be referring to. So assertions, that's like a confident and forceful statement, doesn't really fit with what we're going for. So I'm going to cross that one out for now. Appraisals is an act of assessing something, examining or evaluating something. Maybe, I'll put a question mark there. Affirmations, this is like emotional support or encouragement. Well, that sounds pretty good. That sounds about what we're going for. Absolutes, again, that's a bit too strong of a word for what we're going for a motivational sort of interviewing, counseling situation. And so OARS, if you've memorized it, is open questions, affirmations, reflective listening, and summarizing. So the answer here is C. Question number 12. Fluoride supplementation for a 2-year-old child who lives in a non-fluoridated community can best be accomplished by initially prescribing which of the following? Go ahead, pause the video, and then we'll go over this together. All right, so if they're living in a non-fluoridated community, they're of a certain age, they need some kind of supplementation. And so they list out the 5 common options for fluoride adjunctive therapy. Now let's go through each of these together. Tablets for a 2-year-old, that's going to be pretty hard to chew. So I don't think that's the ideal situation to prescribe a 2-year-old. Lozenges, the little like suck-on kind of candy-looking things, that's not really safe either, right? A 2-year-old child, I wouldn't want them sucking on a lozenge. So we're going to rule that one out as well. Fluoride mouth rinses, well, they haven't at 2 years old developed a coordinated oral musculature to rinse effectively and to spit out rather than accidentally swallow. So that's another one that's not really safe for that age range. And same with fluoride toothpaste. They don't, number one, have manual dexterity, but even if you were helping them brush their teeth, again, just spitting and not accidentally swallowing a large dose of fluoride, that would be a concern of mine as well. So fluoride toothpaste, again, not really the best option. It's not the worst option on this list, but it's not the best option either. So the one that makes the most sense is to deliver a specific small dose of fluoride drops for the patient. And again, this is because any really, really young child like this would have difficulty chewing, swallowing tablets, and manipulating these sorts of things. So the answer here is C. Now, if you're really good, I could ask you a bonus question here. How much fluoride would this person be required per dose? What's the exact dose of fluoride you would prescribe for this child? So we had this little table that we went over, and if they're not getting any fluoride, so that's 0 ppm, and they're 2 years old, so that's between 6 months and 3 years. If we go to our fancy chart here, we would be in this column, less than 0.3 ppms, and we would be between 6 months to 3 years, so that would be 0.25 milligrams of fluoride. Now, I'm not going to say you won't get this on the exam because it's possible that they could ask from this table. So if you have any extra room to memorize some of this stuff, it could be valuable to get a question or two. So if that were the question in this case, the answer would be 0.25 milligrams of fluoride. Okay, question number 13. An amalgam restoration is considered which of the following? Go ahead and pause the video and then we'll go over this one together. All right, so we can go through this one pretty quickly. Unsafe, I just kind of threw this one in as a joke. If utilized properly, of course, an amalgam restoration is certainly a safe material. Primary prevention prevents disease before it occurs. That's like sealants, water fluoridation. Secondary prevention eliminates or reduces disease after it's occurred. Restorations are a good example. Tertiary prevention rehabilitates a patient after the disease process has already taken place. So this is like crowns, bridges, dentures, implants, things like that. So an amalgam restoration, composite restoration would fit in the secondary prevention category. So the answer is B. All right, so the first day of the board exam will be 400 questions with these patient management questions, just like the ones we talked about, sprinkled throughout those 400. And on the second day, you'll have 100 more questions that are case-based. So they'll give you information on a patient, background, medical history, clinical photos, x-rays, but otherwise the questions are very similar. So question 14 and 15, like I've done in the past, will be examples of questions pertaining to the same patient. So Ryan, young Dr. Ryan, is a young child who consistently presents as an anxious, hypervigilant, and upset during dental visits. Oh, sorry. Ryan is often accompanied by his parent, who appears to be very concerned about the child and wants to be involved at all times in her evaluation and treatment. During this visit, Ryan's treatment requires an injection and rubber dam application, which you anticipate may lead to increased anxiety. Which strategy would be least effective in completing the rubber dam application? So go ahead, pause the video. You might want to reread that. I know it's a lot of text. It's a longer question. And let's see what we can do for her, little young Ryan, in this question. So go ahead, pause the video, think through it, and we'll talk about it together. All right, so what kind of options do we have? Tell, show, do, distraction, ask her to be a helper, structure time, or rehearsals. So which would be least effective in completing the rubber dam application? Now this might seem like a little bit of a subjective question, but there is a clear example here based on the wording. So the key, again, this all comes down to locating the key concept, because a robot isn't generating these questions. This is a human who has created this question, and they have a very clear objective. They're testing something in specific, and they want to know that you really understand a certain concept, whatever that is. So in this case, young girl Ryan is an anxious patient. She's very anxious, hypervigilant, and upset, and you have a helicopter mom who's kind of hovering over treatment. So an anxious patient is going to benefit from all of these except one in particular. Tell, show, do is where you tell the patient what you're going to do, you show them the rubber dam, what it looks like, let them hold it, it's not scary, and then you actually do it. That's great for all sorts of patients, so that's certainly something that would be effective. Asking the child to be a helper is another one of those universal, that's always going to be effective kind of things. Structuring your time, that means like setting boundaries, counting, making this 10 minutes be about this procedure and the next 10 minutes being about something else, being very purposeful about what you're trying to accomplish. That's another thing that really you can't go wrong with. And rehearsals with them, going through maybe just putting the rubber dam up against their mouth, letting them hold it up against their mouth to practice, something like that. That's another thing that can really help an anxious patient to get to alleviate some of their anxiety. Here's the one that's not always great. It can be good, but not for an anxious patient, because someone who's very hypervigilant, who's extremely aware of their surroundings and what's going on, you're not going to be able to effectively distract somebody who's hypervigilant. They're going to be aware. They're not going to fool for it. They're not going to be looking at their iPod or their iPad or thinking about something else. It's much harder to distract this kind of child. So the answer in terms of what would be least effective is distraction. The answer is B. All right, and now for young boy Ryan. So Ryan has a strong gag reflex during x-ray procedures, and I actually do. I actually have a pretty strong gag reflex myself. And you suggest that young boy Ryan takes several x-ray packets home and practices holding the packets in his mouth for increasingly longer periods of time. Which of the following techniques does this best exemplify? So go ahead, pause the video, and then we'll go over this last question together. All right, so let's unpack these answer choices. No pun intended. So social reinforcement. This is about positive social consequences for them. Now, the question prompt gives you a very specific example of what we're trying to do. We're giving them these x-ray packets to take home with them, and we're telling him to stick them in his mouth for increasingly longer periods of time. Start with a couple seconds, work up to 5 seconds, 10 seconds, etc. Social reinforcement is not really, this doesn't really correspond with this, so maybe we're not confident enough to completely rule it out. I'll just give it a question mark for now. I want to skip to C. Behavioral modeling is learning proper behavior from role models around you. So this would be like if Ryan had an older brother who did a really good job with this, it would be modeling his behavior. This is not what this is about, so we can rule that one out confidently. Guided imagery, that's imagining a pleasant scene. Imagine being at the beach or Disney World or wherever you really like to be. That's not at all what this is about either. That we can rule out. Behavioral learning is actually a very wide umbrella of things. This is classical conditioning based on stimuli and circumstances, like the Pavlov's dogs we talked about before. This also includes operant conditioning based on rewarding or punishing, and it also overlaps with modeling. And so this doesn't have to do with stimuli or rewarding good behavior, nothing like that. So this isn't behavioral learning either. Systemic desensitization. I had this in red text. It's also known as graded exposure, which might give away the answer. But graded exposure or systematic desensitization is exposing a patient to items from an agreed upon hierarchy of slowly increasing feared stimuli, allowing them to pair a relaxation response with a feared stimuli. That's the actual definition. In layman's terms, that means you're starting from something less scary and building up to something more scary. So for this patient, if they have a strong gag reflex, a lot of that can be physical. It can be physical stimulation of the nerve, but it also can be, there's a psychological component. And so if you're starting with a very small amount of time with the x-ray packet, you're starting with maybe a smaller one and working up to a bigger one. As this question prompt says, we're increasing the period of time that the packet's in their mouth. That's a great example of grading that stimuli, starting from something a little more manageable and going to something a little bit more feared, scary, and not as tolerable. So this is certainly a tricky question, but it's a good example of systematic desensitization for the patient. So the answer here is B. All right, so that's it for this video. Thank you so much for watching, everyone. I really hope these practice questions are useful for you as you go through them. Again, you could go through them again, flip the questions around, and try to reword the questions to make the other answer choices correct, and see how that does. See if you get anything more out of that. So if you like this video, please give it a thumbs up. Share it with your friends. Subscribe to my channel if you haven't already for more awesome dental prep content. Thank you so much for watching, everyone. If you're interested in supporting my channel and what I do, please check out my Patreon page. A huge thank you to Michael Raja, Reb Boyd, Leonilla Bunger, David Jaden, Yanet, Nicole, Isabella Caldis, Ali Benjdeer, Jacob K, and all of my patrons for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams, in addition to the ones we just went over here. So go check that out. The link is in the description below. Thanks again for watching, everyone. I'll see you in the next video.